Hello, my name is Nicole Pereira, and I'm a clinical nurse specialist in pediatric intensive care in Canada. And I'm also a PhD health quality student at Queen's University in Kingston, Ontario. When I think about women in leadership and working toward an equal future, the first thing I acknowledge is our history. Historically, women have been marginalized, subjugated, and discriminated against, and we still have a ways to go to achieve an equal footing with our male counterparts. But the very next thing I think about is the definition of woman, because our definition of sex and gender has and continues to change over recent years. I'm conscious of the fact that as we continue to work toward the goal of changing the system, we will need to ensure we are not unintentionally continuing to marginalize, subjugate, and discriminate against those who do not meet our historical bimodal definition of what it means to be a woman. The third thing that I think of is the term equality. And when I place it in context of the messy, beautiful reality of what it means to be a human being, I'm not certain equality is or should be the goal. In any definition of women, there are real biological, psychological, and social factors that set women apart. It has to do with our chemical and hormonal makeup, the way we were raised, and the social norms of the societies we live. Our uniqueness is our strength. And so when I think about what the goal should be, I think more about equity. And the question becomes, how can we work toward fostering a world where the differences of being a woman are no longer barriers? In summary, as we move through and hopefully out of the COVID-19 era, my hope is that we can continue to challenge the bimodal definition of sex and gender and work toward a world where we can celebrate our uniqueness and where that uniqueness is not a barrier to fostering women in leadership.